is a guide for using the Iridex Cyclo G6 laser in the operating room at all of you. First step is to plug in the laser. After that, turn the laser on. Here the key is shown in the off and on positions. When you turn on the laser, the screen is going to say no delivery device until a probe is plugged in. So here are the two different probes. If you're doing a regular CPC, you use a G probe, while if you're doing a micropulse, you use the P3 probe. Both of these probes are available at the OR front desk, and just ask the OR staff to get the probes for you. So after turning on the laser, you want to plug in the probe in the port shown right here. When the probe is plugged in, the screen should automatically read the probe and either say G probe at the top or micropulse P3 device at the top. When that screen pops up, you want to click OK to load the default laser settings. After that, the laser is going to make sure that everyone in the room puts on safety glasses. So there are safety glasses in the cart. Go ahead and have everyone put these on. If there's more people than glasses, then some people should leave the room. After everyone has glasses on, then you can say OK to verify that the safety filter is in place. Then you can further fine-tune the settings of the laser that you're doing, or just leave them on the default settings. Here's a chart of the different laser settings that you can use for the CPC versus the micropulse. In general, for the CPC, it's okay to hear pops on some of your applications, but you don't want to hear a pop on every application. So if you're hearing a pop on every application, then you want to turn the power down. If you're not hearing any pops, then you may want to turn the power up. As far as how to perform the laser, here are the instructions for performing the CPC. You want to hold the G probe parallel to the visual axis with the shorter edge of the footplate firmly between the anterior border and the middle of the limbus. And then you want to do successive applications, 360 degrees, with about 18 to 21 applications total. And you can try to spare the direct nasal and temporal areas, as that's where you have nerves. As far as the micropulse, you can see the side view of the probe here. So this is done first in the superior quadrant and then in the inferior quadrant. The superior quadrant, you want to go from 930 to 230, applying firm pressure and moving the device continuously back and forth while applying the laser continuously. You do this for 4 to 7 complete passes for about a total of 50 seconds. And then you do the same thing in the inferior quadrant again for 50 seconds, going from 330 to 830 back and forth continuously. After that, you want to finish up, put on ointment and patch the eye, throw away the probes because they're one-time use. On the first postoperative day, the laser likely won't have taken effect yet, so you want to leave the patient on some or all of their preoperative IOP lowering drops, depending on how many they were on, and then put them on a steroid and a cycloplegic. Follow the patient up again in 1 to 2 weeks, and just keep in mind that it may take a few weeks to see the full effect